372. A nurse is assessing a client who struggles with social phobia. Which assessment question does the nurse need to ask? 1. Do you drink alcohol or use illicit drugs? 2. Do you use physical outlets to handle anger? 3. Do you often struggle to control your impulses? 4. Do you have a history of being an underachiever? Answer. 1. Clients with social phobia are highly likely to consume alcohol or use or abuse other substances to control the fear they experience in specific social situations. Clients with social phobia don't tend to be angry or aggressive, struggle to control their impulses, or have a history of underachievement. 373. After a nurse teaches a client with generalized anxiety disorder some strategies for coping with stressors, another goal for the client would be to 1. Recognize the signs associated with an elevation in mood. 2. Learn to obtain assistance when his anxiety is increasing. 3. Develop guidelines for decreasing manipulative behavior of peers. 4. Explore ways to facilitate participation in self-care activities. Answer. 2. It's important for a client to identify when his anxiety is escalating, when his anxiety may be getting out of control, and when seeking help is necessary. Recognizing the signs associated with an elevation in mood, developing guidelines for decreasing manipulative behavior of peers, and exploring ways to facilitate participation in self-care activities are goals appropriate for a client diagnosed with bipolar disorder, not generalized anxiety disorder. 374. A client with post-traumatic stress disorder, PTSD, is preparing for a family meeting. The nurse who's working with the client should encourage him to share which topic with family members. 1. Struggling to stop engaging in people-pleasing behaviors. 2. Using medications to help cope with feelings of survivor guilt. 3. Difficulty being emotionally attached to people. 4. Difficulty handling the hallucinations experienced after a trauma. Answer. 3. Clients who suffer from PTSD tend to avoid emotional attachments as a way to protect themselves from the trauma they've experienced. Clients with PTSD don't tend to engage in people-pleasing behaviors or experience hallucinations after the experience of extreme trauma and loss. Although clients with PTSD may be prescribed medications to assist in symptom reduction, there aren't any drugs used specifically to help clients handle their feelings of survivor guilt. 375. A nurse is observing a client on a medical unit who's pacing the room, shaking his head from side to side, and clasping and unclasping his hands. As the nurse reviews the client's health history, she should be alert for information about which medication that could be linked to the client's behavior. 1. Anticholinergics. 2. Vasodilators. 3. Antiemetics. 4. Steroids. Answer. 4. Clients who have taken steroids can experience a manic episode. Anticholinergic, vasodilator, and antiemetic drugs don't induce a manic episode. 376. A nurse is caring for a client who has generalized anxiety disorder. Which statement about this client is true? 1. The client has regular obsessions. 2. Relaxation techniques are necessary for cure. 3. Nightmares and flashbacks are common in this client. 4. His anxiety lasts longer than 6 months. Answer. 4. Constant patterns of anxiety that affect the client for more than 6 months and interfere with normal activities are characteristic of generalized anxiety disorder. Pharmaceutical therapy with benzodiazepines can help. Clients having regular obsessions are probably suffering from obsessive-compulsive disorder. Nightmares and flashbacks are typical symptoms of post-traumatic stress disorder. 377. A nurse is caring for a client who suffers from depression. She tells the client that he must avoid cheese, yogurt, preserved meats, and vegetables. Based on this information, the client is most likely receiving which drug therapy to treat his depression? 1. Monoamine oxidase inhibitor, MAOI. 2. Benzodiazepine. 3. Selective serotonin reuptake inhibitor, SSRI. 4. Tricyclic antidepressant, TCA. Answer. 1. This client is receiving an MAOI, which requires the client to avoid tyramine-rich foods, such as cheese, beer, wine, yogurt, and preserved fruits, vegetables, and meats. Benzodiazepines, SSRIs, and TCAs don't require dietary restrictions except avoiding alcoholic beverages. 378. A client is experiencing acute confusion due to poisoning from an accidental exposure to toxic chemicals in the workplace. What type of behavior should the nurse expect this client to demonstrate upon admission to the nursing unit? 1. Inability to eat without experiencing nausea. 2. Frequently verbalizing ambivalent feelings. 3. Difficulty expressing ideas and needs. 4. Despondency in the presence of AMLE members. Answer. 3. A client with delirium has disorganized thinking and has difficulty expressing his ideas and needs to the nurse. A client in a state of confusion can usually eat without experiencing nausea, doesn't tend to verbalize feelings of ambivalence, and doesn't demonstrate irritability in the presence of others. 379. A nurse is caring for a 78-year-old client hospitalized with bilateral pneumonia. Shortly after admission, he became extremely belligerent, confused, and hypotensive, and he developed tachypnea. The nurse prepares the client for intubation, administers anti-infective stat, and requests that the computed tomography (CT) scan of his head be delayed. Why? 1. His change in mental status was related to hypoxia, metabolic encephalopathy, and sepsis. 2. Taking this client to the radiology department would jeopardize his condition. 3. The client exhibited no signs of focal neurologic impairment. 4. His prognosis was poor and didn't justify a CT scan. Answer. 1. Severe functional abnormalities and confusion are commonly caused by non-neurologic diseases, especially in elderly clients. Encephalopathies such as these are reversible if the underlying cause is treated. An unstable condition, absence of signs of focal neurologic impairment, and poor prognosis aren't appropriate justifications for delaying a diagnostic CT scan. 380. A client with dementia suffers from sundown syndrome. Which nursing action should be included in this client's care plan? 1. Integrate the client's cultural preferences into the care provided. 2. Maintain a consistent schedule and sequence of daily activities. 3. Provide opportunities for the client to learn and practice new skills. 4. Serve a warm beverage and snacks in the early evening. Answer. 2. A client with dementia benefits from a consistent schedule of activities. Routine is reassuring and can promote comfort. Cultural preferences don't tend to influence the client's agitation. Providing opportunities to learn and practice new skills could upset the routine and cause additional agitation. Although serving a beverage and snack is a thoughtful strategy to implement, it won't decrease the potential for agitation associated with sundown syndrome. 381. A nurse is teaching the wife of a client who has mild symptoms of dementia how to more effectively communicate with her spouse. The teaching would be considered successful if the nurse observed the wife. 1. Having a face-to-face conversation with her husband. 2. Talking quietly into her husband's ear. 3. Discussing only events related to their past. 4. Speaking loudly and enunciating each word. Answer. 1. Speaking face-to-face is the most effective strategy to use when communicating with a cognitively impaired client because it allows the client to pick up visual cues to assist him in understanding his wife. Talking directly into the client's ear prohibits the client from having access to the reinforcement of nonverbal communication. It isn't good practice to assume that all recent memory is gone. It is better to stay current, explain things, and orient as necessary. There's no need to speak loudly and enunciate each word to a client with mild dementia unless he has a hearing impairment. 382. A nurse is assessing a client for vascular dementia. Which finding helps confirm the diagnosis? 1. Positive drug screen for toxicology. 2. Findings upon autopsy. 3. Magnetic resonance imaging, MRI. 4. Response to electroconvulsive therapy. Answer: 3. Vascular dementia is commonly caused by cerebrovascular disease and small infarctions, which can be detected with MRI. A positive drug screen wouldn't be helpful in diagnosing dementia caused by vascular problems. Attempts to diagnose vascular dementia wouldn't be delayed until autopsy. Electroconvulsive therapy is occasionally used in the treatment for selected psychiatric disorders, but isn't a diagnostic tool for dementia. 383. A nurse is planning care for a client with substance abuse delirium. When the nurse implements care that addresses the client's hygiene needs, which action should be taken? 1. Provide an electric shaver instead of a razor. 2. Administer medication before starting care. 3. Set limits for staff involvement in the client's daily care. 4. Bathe the client, but permit the client's family to dress him. Answer: 1. For a client with delirium, using an electric shaver is preferable because the client may be predisposed to injury if a standard razor is used. Medication is administered to promote comfort and address illness issues, not to promote the client's participation in self-hygiene. The client requires assistance during the recovery process, not limits for staff involvement. Bathing the client facilitates dependency. The goal is to provide optimal functioning and self-care ability. 384. A nurse is caring for a client who is diagnosed with delirium. What must the nurse provide for the client? 1. A safe environment. 2. An opportunity to release frustration. 3. Prescribed medications. 4. Medications, as needed, judiciously. Answer: 1. Keeping the client with delirium safe is the most important aspect of care. All other choices are logical and appropriate, but safety issues and meeting the client's basic physiologic needs are of primary importance. 385. Which of these statements related to information technology is accurate? 1. Social networks and cell phone cameras pose low risk in terms of information technology security and confidentiality. 2. The security of technological data and information in healthcare environments is most often violated by those who work there. 3. The security of technological data and information in healthcare environments is most often violated by computer hackers. 4. Computer data deletion destroys all evidence of the data. Correct response: 2. The security of technological data and information in healthcare environments is most often violated by those who work there. The vast majority of these violations occur as the result of inadvertent breaches with carelessness and the lack of thought on the part of employees. Technology is a double-edged sword. Technological advances such as cell phone cameras, social networks like Facebook, telephone answering machines and fax machines pose great risk in terms of the confidentiality and the security of medical information. Computer data deletion does not always destroy all evidence of the data. Data remains. 386. Select the legal term that is accurately paired with its description. 1. Assault, touching a person without their consent. 2. Battery, threatening to touch a person without their consent. 3. Slander, false oral defamatory statements. 4. Slander, false written defamatory statements. Correct response: 3. Slander is false oral defamatory statements, and libel is written defamation of character using false statements. Assault, an intentional tort, is threatening to touch a person without their consent, and battery, another intentional tort, is touching a person without their consent. 387. You have loosely applied a bed sheet around your client's waist to prevent a fall from the chair. What have you done? 1. Ensured the client's safety, which is a high patient care priority. 2. Violated respondeat superior. 3. Violated the client's right to dignity. 4. Committed a crime. Correct response: 4. When you loosely apply a bed sheet around your client's waist to prevent a fall from the chair, you have falsely imprisoned the client with this makeshift restraint. False imprisonment is restraining, detaining and/or restricting a person's freedom of movement. Using a restraint without an order is considered false imprisonment even when it is done to protect the client's safety. Respondeat superior is the legal doctrine or principle that states that employers are legally responsible for the acts and behaviors of its employees. Respondeat superior does not, however, relieve the nurse of legal responsibility and accountability for their actions. They remain liable. 388. Which statement about respondeat superior is accurate? 1. Respondent superior does not mean that a nurse cannot be held liable. 2. Respondent superior does not mean that a nurse cannot be held liable. 3. Respondent superior is an ethical principle. 4. Respondent superior is a law. Correct response: 1. Respondent superior does not mean that a nurse cannot be held liable and not libel, which is a written defamation of character using false statements. Liability is legal vulnerability. Respondent superior is the legal doctrine or principle and not a law or ethical principle. 389. Which of these choices contains the 6 elements necessary for malpractice? 1. Causation, foreseeability, damages to the patient, a duty that was owed to the client and this duty was breached, and direct rather than indirect harm to the client. 2. Causation, foreseeability, damages to the patient, a duty that was owed to the client and this duty was breached, and direct and/or indirect harm to the client. 3. Causation, correlation, damages to the patient, a duty that was owed to the client and this duty was breached, and direct and/or indirect harm to the client. 4. Causation, foreseeability, damages to the patient, a duty that was owed to the client and this duty was breached, and a medical license. Correct response: 2. The 6 essential components of malpractice include causation, foreseeability, damages to the patient, a duty that was owed to the client and this duty was breached, and, lastly, this breach of duty led to direct and/or indirect harm to the client. A medical license is not necessary. Nurses and other healthcare professionals can be found guilty of malpractice. Lastly, correlation is the relationship of simultaneously changing variables. 390. The current focus of performance improvement activities is to facilitate and address 1. Sound structures like policies and procedures. 2. Processes and how they are being done. 3. Optimal client outcomes. 4. Optimal staff performance. Correct response: 3. The current focus of performance improvement activities is to facilitate and address optimal client outcomes. Throughout the last several decades, performance improvement activities have evolved from a focus on structures to a focus on process and now, to a focus on outcomes. Staff performance is not the focus of performance improvement activities, but instead the focus of competency assessment and validation. 391. What is the term that is used to describe a healthcare-related incident or accident that may have possibly led to client harm? A. An adverse event. B. A root cause. C. A healthcare-acquired event. D. A sentinel event. Correct response: D. A sentinel event is an event or occurrence, incident or accident that has led to or may have possibly led to client harm. Even near misses that have the potential for harm are considered sentinel events because they have the potential to cause harm in the future. An adverse event, like an adverse effect of a medication, has actually led to an adverse response. It is not a near miss. A root cause is a factor that has led to a sentinel event, and there is no such thing as a healthcare-acquired event. 392. The primary purpose of root cause analysis is to A. Discover a process flaw. B. Determine who erred. C. Discover environmental hazards. D. Determine basic client needs. Correct response: A. The primary purpose of root cause analysis is to discover process flaws. Root cause analysis and a blame-free environment are essential to a successful performance improvement activity. Therefore, root cause analysis does not aim to determine who erred and made a mistake. Root cause analysis explores and digs down to the roots of the problem, its root causes and the things, not people, which are the real reasons why medical errors and mistakes are made. It is nursing assessment that determines the basic client needs and environmental surveillance that discovers environmental safety hazards, and not root cause analysis. 393. The primary distinguishing characteristic of risk management when compared and contrasted to performance improvement is that risk management activities focus on a. Historical data and performance improvement activities focus on current data. B. Current data and performance improvement activities focus on historical data. C. Decreasing financial liability and performance improvement activities focus on process improvements. D. Decreasing falls and performance improvement activities focus on process improvements. Correct response, C. The primary distinguishing characteristic of risk management when compared and contrasted to performance improvement is that risk management activities focus on decreasing financial liability and performance improvement activities focus on process improvements. Risk management focuses on decreasing and eliminating things that are risky and place the healthcare organization in a position of legal liability. Some examples of risk management activities include preventing hazards and adverse events such as patient falls and infant abduction and the legal liabilities associated with these events. 394. Your client has been getting total parenteral nutrition for bowel rest for the last 4 days. During your assessment of the client today, your client tells you that their chest hurts. You assess that the client is also experiencing dyspnea. What is most likely occurring with this client? A. Your client may be experiencing a fluid overload. B. Your client may be experiencing an embolus. C. Your client may be hyperglycemic. D. Your client may have an inadvertent pneumothorax. Answer, B. The client may be experiencing an embolus, which is a complication of total parenteral nutrition. Some of the signs and symptoms of an embolus are chest pain, dyspnea, shortness of breath, coughing, and respiratory distress. Emboli, secondary to total parenteral nutrition, occur when air is permitted to enter this closed system during tubing changes and when a new bottle or bag of hyperalimentation is hung. This complication can be prevented by instructing the client to perform the Valsalva maneuver and the nurse's rapid changing of tubings and solutions when the closed system is open to the air. An inadvertent pneumothorax can occur and become symptomatic during the insertion of the TPN catheter and not 4 days later. Other side effects of TPN and their signs and symptoms. 1. Infection. The classical signs of infection including a fever, malaise, swelling and redness at the insertion site, diaphoresis, chilling and pain in the area of the TPN catheter insertion site. 2. Fluid overload, hypertension, edema, adventitious breath, sounds like crackles and rowels, shortness of breath, and bulging neck veins. 3. Hyperglycemia, high blood glucose levels, thirst, excessive urinary output, headache, nausea and fatigue. 4. Hypoglycemia, low blood glucose levels, shakiness, clammy and cool skin, blurry vision, diaphoresis and unconsciousness and seizures. 395. Which statement about total parenteral nutrition is true? A. Clients are at high risk for infection when they are getting TPN because they are immunocompromised. B. Clients are at high risk for hyperglycemia when they are getting TPN because they are diabetic. C. The client should perform the Valsalva maneuver when the nurse changes the TPN tubing. D. The client should perform the Valsalva maneuver when the nurse changes the TPN dressing. Answer, C. The client should perform the Valsalva maneuver when the nurse changes the TPN tubing to prevent an embolus, which can occur when the tubing is open to the air while it is being changed. A mask, not the Valsalva maneuver, is indicated for TPN dressing changes. Lastly, clients are at risk for infection secondary to TPN because these solutions are high in dextrose and because TPN is an invasive sterile procedure, and clients are at high risk for hyperglycemia when they are getting TPN because these solutions are high in dextrose and not because the client is already a diabetic client. 396. Which tool or scale would you use for a focused neurological assessment of your client? A. The Lazarus Cognitive Appraisal Scale. B. The Hamilton Rating Scale. C. The Mcgill Scale. D. The Rancho Los Amigos Scale. Answer, D. The tool or scale that you would use for a focused neurological assessment of your client is the Rancho Los Amigos scale. Levels of consciousness, which is part of a complete focused neurological assessment, can be determined and measured by using the standardized Glasgow Coma scale for adults and children or the Rancho Los Amigos scale. The Rancho Los Amigos scale determines the patient's level of awareness and functioning, which can range from a 1 to an 8, when a 1 is the complete lack of all responsiveness to all stimulation and an 8 is when a patient is fully alert, oriented, appropriate and purposeful. The Mcgill pain assessment is used to assess pain levels, the Lazarus cognitive appraisal scale is used to assess levels of stress and coping, and the Hamilton rating scale is used to measure and assess depression. 397. You are the nurse in an ambulatory surgical center. Which of the following risk factors are associated with impaired and delayed healing? A. A lack of zinc. B. A lack of vitamin E. C. High iron levels. D. High phosphorus levels. Answer, A. A lack of zinc, copper, iron and vitamin C and A are risks associated with impaired and delayed wound healing. Other risk factors that impede wound healing are 1. Advancing age. 2. Nutritional status. 3. Some poor lifestyle choices. 4. Some medications. 5. Some diseases and disorders. 398. As a nurse preceptor, you are in the operating room with a student nurse. The client has received general anesthesia. The student nurse says, "Oh no, the general anesthesia is not working." The client is shaking and moving. How should you respond to this student nurse? A. The client is having anesthesia awareness, which is not good. B. This often happens during stage 2 of general anesthesia. C. The client needs more general anesthesia. D. The client is having a seizure. Answer, B. You should respond to this student nurse by stating, "This often happens during stage 2 of general anesthesia." Stage 2 of general anesthesia, often referred to as the excitement stage, is characterized with uncontrollable muscular activity, irregular respirations, an irregular cardiac rhythm, and, at times, vomiting. This stage does not indicate the need for more general anesthesia. Anesthesia awareness, which is a rare complication of general anesthesia, is the lack of amnesia during surgery when the client remembers events during surgery and, at times, they remember the pain. There is no evidence in this question that the client is having a seizure. 399. Which of the following is not a procedure to reduce risks associated with invasive surgeries? A. Surgical site marking. B. A timeout. C. Medication reconciliation. D. A neutral zone for sharps. Answer, C. Medication reconciliation prevents medication errors and other complications associated with medications and not a way to reduce surgical risks. Surgical marking, timeouts that are done after surgical site marking is done, and a neutral zone for sharps do reduce surgical risks such as wrong site surgery, wrong patient surgeries and sharps injuries. 400. Which of the following is a nursing diagnosis that reflects some unexpected response to a therapy? A. Episiotomy extension related to a forceps delivery. B. Respiratory depression related to NSAIDs. C. Hemothorax related to a latex allergy. D. All of the above. Correct response, A. Maternal trauma, lacerations, pelvic floor damage, bleeding and an inadvertent extension of the episiotomy to the anus when a forceps delivery of a newborn is done. Respiratory depression can occur as the result of narcotic analgesics such as morphine, and not NSAIDs. Pneumothorax and hemothorax can occur as the result of an inadvertent perforation during invasive procedures such as the placement of a total parenteral nutrition catheter and a thoracentesis, and the signs and symptoms of a latex allergy include tachycardia, hypotension, dyspnea, chest pain tremors, and anaphylactic shock, not respiratory depression.